So on behalf of our administrative team and over 500 employees that call Coosa Valley home, thank you for letting us be here today to share some insight into you about medication. And we love coming to work at Coosa Valley every day, and fulfilling that mission statement is what we get up and we do. And I'm so blessed to be able to call Coosa Valley my work home. A little bit about myself. That's my family up on the board. Like Vanessa said, I am a local guy. I was born and raised here. I graduated from Sylacauga High School in 2004. Hard to believe that next month will be 21 years, but here we go. And a double graduate of Auburn University, bachelor's in biomedical sciences in 2008. And then I started right into the pharmacy program and graduated with a doctorate of pharmacy in May of 2012. I married my wife Meg in 2015. We have 2 daughters. Mary Griffin, that's her on the right with blonde hair. She's 4, and Sarah Beth is on the left. She's 2. A little bit dated picture, but that's our most current family picture that was professionally done. And I'm a member. We're both members of First Baptist Church here in Sylacauga, and like I said, I've had the pleasure of serving as the pharmacy director at Coosa Valley since January of 2019. Anyway, that'll work. We have a trivia question here for you. How many licensed pharmacies are located at Coosa Valley Medical Center? And I want you to raise your hand. So here are your choices. We have 0, and I put that on there because when I left community practice and to go to the hospital, people say, well, I didn't know the hospital had a pharmacy. We do, so you know it's not 0. So is the answer 1, 2, or 3? And I'll be happy to call on whoever raises their hand first. You say 1? 3? Well, you are correct. And you get a gift card. And I am very, it was a very generous gift card provided by Vanessa and Rosa for a $50 gift card to the foundation. So, I mean, to the Valley from the foundation. So, congratulations. So let's dive in to learn a little bit about those pharmacies. We have the institutional pharmacy, or what we just call hospital pharmacy. So that's located on the first floor at the hospital, and this is primarily where I'm located out of. This is the hospital pharmacy that takes care of you, whether you're an inpatient or outpatient facility, whether you're in the ICU or you're med-surg, or you're there for an outpatient procedure in our radiology department and contrast provider. We provide all those medications. So if it happens on the campus of Coosa Valley and you're an inpatient or an outpatient, the medicines flow through us, and our primary focus is to get those medications to you. We also do a lot of sterile compounding, and so what that means is a lot of times when you're in the hospital, you have to have IV medications, and we have to make those. Not everything can just come in a pill. A lot of times, it's best when you're in a hospital setting to get those IV medications because you get 100% of it just immediately. Whereas tablets, everything has to be absorbed and metabolized through the body, and we do a lot of that, including chemotherapy for our oncology, hematology and oncology department. We also do non-sterile compounding, and we work with the entire healthcare team to optimize care, specifically focus around medications, and we also make sure that our antibiotics and our pain medications are used appropriately. Pharmacy number 2 is Coosa Valley Apothecary. It's located in the main lobby of the hospital, right behind the little circular desk where the pink lady sit. It's a traditional retail store. We opened it in October of 2019, and we fill employee prescriptions, and we also have a prescription bedside delivery service. So we call it meds to bed. So if you're in the hospital and you're going home with prescriptions, you're going to get a visitor from one of our employees in the apothecary, and it wants you to use get your prescriptions filled before you go home, because we feel that once you leave the hospital, you probably want to go home. You don't want to make a stop at the drugstore. And so this allows us to have your prescriptions in hand. Anything that the doctor wants to write new, or something that, say you're in the hospital for a UTI and they want to continue antibiotic, you can get that filled from us and you can go straight home with it. Like I said, it's located in the main lobby, and we offer a lot of vaccines, and it's a traditional retail store. Pharmacy number 3, we have a dual accredited specialty pharmacy. So you might say, well, what is a specialty pharmacy? It's a pharmacy that fills a lot of medications that cost a lot, but it's a pharmacy that follows the patient's therapy a little bit more closely than a traditional retail store, and provides documentation to insurance companies, because they dictate that a lot of those high dollar medications for disease states like cancer or for some gastroenterological disease states require that they go through a specialty pharmacy. So we opened this in June of 2023. We fill a lot of oral chemo from our oncology clinic. But it's a really good service line that's it's been good for us, and it's closest one around here is Birmingham or Montgomery. So if you see Dr. Nix or Dr. Garris, and he's referred you to a dermatologist or a gastroenterologist, and you get a specialty medication filled from those, from those providers, you can get it here, and we can ship it right to your door. Like I said, it's a new pharmacy, it's a new concept for this region, but it's been very good for us, and as well as been good for our patients. So what does a pharmacist do? We do a lot more than just dispense the medication. Obviously, that's our primary job, is to get the medication to you. But the first thing that we have to do as a pharmacist is to review every medication or prescription to make sure it's appropriate. Make sure it's the right dose. Does it interact with any other medications? Does it interact with any disease states or any food interactions? And we monitor that there, especially in a hospital setting or like specialty pharmacy, where we have labs and we can monitor you. We're going to monitor you and make changes as necessary. We make those recommendations either through established protocols or call the physician and say, hey, this patient's status has changed. We need to do that. We also provide help to our medical staff. As previously mentioned, we compound medications and we counsel and provide immunizations. So a little bit on the heart of the subject today is medication safety. We're the drug experts. 82% of Americans take at least one medication, so that means the vast majority of our country is going to be visiting one of my colleagues every 30 or 90 days. So we're there as the drug experts use us, ask us questions. And 29% take 5 or more medications, so they're going to be visiting us a little bit more frequently. We have a responsibility to make sure that you're aware of side effects and be available should you have questions about your medications. And adverse events are likely going to grow a little bit over the coming few years, because we have a lot of new medications coming to market, and we've got a lot of established medications. We're going to have to learn how those work together. We're finding new ways of treating diseases with old medications, and our population is just getting older. And as we know, our seniors are going to be taking more medications than anybody else. And so we just monitor everything to make sure that you're on the right track, and we do a lot of work in the background. Medications are generally safe when they're used as prescribed to treat diseases, relieve symptoms, and manage conditions. But talk to your doctor or pharmacist about your medications should you have any questions. We're there. We want you to be informed. We want you to know your medicines, know your pharmacists, and ask questions. I put this slide early in the slide deck because it's probably the most important slide that I want you to hear today. Who all has a list of their medications? Good. If you don't, make sure you get that done, because that is very, very important. You want to make sure that the list is accurate and is kept up to date. On this list, you should make sure you have the name of the drug, of course, how often you take it, why you take it. If you don't know, ask. We don't mind answering any questions. Who wrote it, and that's important too, because if a cardiologist wrote something, it can be used sometimes for multiple different things. It can also treat for blood pressure, or it can have a specific reason for the heart. So it adds a little bit extra layer there to know who prescribed it. And if any allergies, if you're allergic to any medications, or it's not even have to be medications, if you're allergic to peanuts, put that on your list. Any allergies you have, put it on your list. And share it with all of your doctors and keep it up to date. Because one of the first things that we're going to ask for when you show up to our door is, what medications do you take? And it's real easy to keep that list in your pocket or your wallet or on your phone, and they can go and make a copy of it and put it in your chart or put it in the computer. But it just leads for, a better communication between the healthcare team and helps decrease medication errors. Always, always, always read the label and follow directions carefully. That's very important. Stick to a schedule. A lot of times medications you take once a day, some are 2, 3, 4 times a day. Have a set time that you try to take your medications. If you take them once a day, and then if you have to take them twice a day or 3 times a day, try to space them out the best you can. And set reminders on your phone, have calendar reminders, whatever it takes for you to be able to remember those. Pill boxes help, because I take a lot of supplements, but sometimes I don't know if I took it or not. So if you put it in the pill box, and you go back a couple hours later, and the pill box is empty, you know you took it. And if it's still there, obviously you know you got to take it. So that's always a challenge with pill boxes. Help keep us organized and keep us on the right track. Be aware of side effects. It is absolutely impossible to know every side effect of every single drug, even for me. You just can't do it. But when you get that new prescription and it comes with that leaflet, just read over it. That way you know what the common things are that you can expect. But also, if you expect something unusual, you can have that pamphlet to refer back to. But if not, you can always call the doctor or the pharmacist. Watch for interactions. We're going to tell you about the big ones. We're going to dive into those a little bit more on this slide. Obviously, drug-to-drug interactions are the most common, and it's most things that we look out for as pharmacists because we have a lot of visibility into that on our computer screen and the software that helps us dispense prescriptions. But there's also more than just drug-to-drug interactions. There's drug-food interactions. Grapefruit and grapefruit juice interact with some medications. They alter the way that our body breaks it down. Dairy. A lot of times medications, specifically antibiotics, come to mind. Some antibiotics, you've got to separate them by 2 or 3 hours. And that's where, as a pharmacist, we can come into play and say, hey, I always try to do this when I practice community pharmacy and say, hey, this antibiotic, you can't take it for 2 or 3 hours around dairy. You can have dairy later, you can have dairy before, but just make sure you separate it. And then it's also important that some medications have to be taken on an empty stomach. Some have to be taken with food. Some even have to be taken with a high-fatty meal. So it's important to know those kind of things. And that leaflet, sometimes, we're busy and we miss things. We're all human, right? That leaflet should tell you. But I also try to make sure that the important things about each individual medication, I relay that to patients. Drug chemical interactions. Alcohol interacts with a lot of things. Absolutely no Tylenol with alcohol because it's very harmful to your liver. Tobacco as well. It affects the way that medications are broken down in the body. Drug disease interactions. If your kidney function isn't as great as it once was, a lot of times we have to dose reduce medications to make sure that you're not getting too much because a lot of medications are eliminated from our body through the kidneys. And if they're not up to 100% or 80% or 70%, we got to know that and we can dose reduce that. But we know that through labs. And that's my team at the hospital, that's one of the things that we look at every patient daily, is to see if anything needs to be dose reduced for any kind of reason. And a lot of times we have protocols in place we can do that. If not, we call the doctor and say, hey, and they're always saying, yes, please. Because they always expect us to look out for those kind of things for them. Because they're busy people too. They got to be in the hospital, they got to be in the clinic, and they got a lot of patients to take care of. Drug laboratory test interactions. Some medications can cause false positives, false negatives, but probably of the 5 things, that's probably the least important of the bunch. Factors which contribute to interactions. So if you take multiple drugs or see multiple doctors, most people do, they have specialists that they go to, that's where that list comes into handy. That way everybody knows what you take. A lot of times multiple disease states, and what we don't want to do is start treating side effects of drugs. That's a real thing. You see people taking 10 or 12 things, a lot of times we're probably treating side effects, and that's where a pharmacist should come in and say, hey, let's go through these things and figure out why you're taking each one and why. If you don't take your medicines like you're supposed to, that can lead to interactions as well. To continue on with some medication safety do's, we want to make sure that they're stored in the right place. The kitchen and the bathroom are the worst places to store medications. Why? Heat and humidity. We have heat, we cook in the kitchen, it heats up. Medication should be kept at controlled room temperature, 68 to 77 degrees, unless they need refrigeration. Find a place that's out of direct sunlight and it's away from children. If you have children or grandchildren that can get into those things, that's not in the kitchen or bathroom. Top of the closet's good, just that's kind of where we keep all our stuff, away from our little ones. And it's not going to get any sunlight. But keeping them in the right places is appropriate because you don't want them to degrade all that with that heat and humidity. Things that require refrigeration, I usually always try to tell people, hey, make sure that you put this in the refrigerator. Insulin comes to mind. A lot of times when you get it from the drugstore, it's going to be in that bag with all of the other things that don't require refrigeration. So if you're unsure, just ask. Most time tablets can go in room temperature, but insulin is one thing that comes to mind that you need to keep in the refrigerator unless it's in use. It's fine to sit out at room temperature for 28 days while you're using it. But if you get a 90-day supply, you're not going to use all 90 days at one time. So keep the rest of it in the refrigerator. You want to get expired medications and medications that you no longer need out of your house. And so you may say, how do I dispose of them? You can do one of two things. You can consult the FDA or EPA flush list. And if it's on that list, it can go in the toilet. If it's not, it shouldn't go there. And I always say, avoid trash disposal as well, because that's still going to go to the landfill and going to get into the soil and the water supply at some point in time. So what can you do? A few months back, we put in a drug disposal bin in the apothecary in the main lobby of the hospital. So you don't have to consult a flush list, or you can just bring them to us. It's located conveniently right behind where Miss Judy sits, right behind that door. And you can walk in and you can put your medications in there, no questions asked, and it's free. The only thing we ask is you just limit it to medications. No no diabetic testing supplies, no needles, no syringes, just medications. And you can put them in there and it's safe and secure. You open the lid just like you would at the post office, and you drop it in and it closes. And then it takes two pharmacists, usually myself and the pharmacist that's in the apothecary. We go down there and box it up, and we have a system that can ship them. We can ship them back to our place who gets our expired drugs to the hospital. And they destroy them upon arrival. So you don't have to worry about any protected health information. You can just drop it in, and they're going to get incinerated whenever they get where they're going. And one reason we did this, because it's a good service that we want our community to use, but we hope that it will decrease the abuse and misuse of prescription drugs, especially opioids. So talk just a little bit about the opioid epidemic. Guys, we have a public health crisis in this country around opioids. Opioids are pain medications. In the 1990s, they started to be widely misused and overprescribed. And as of 2022, there were 224 people that died every day from an opioid overdose. And opioids are the reason for 76% of overdoses. So one thing we want to do is focus on prevention, make sure that you're aware of what medication you have, and also there are alternatives to opioids. Really focused around our youth. Make sure that you know the warning signs of addiction and be able to get those people help whenever they need it. Most states, including ours, allows you to have Narcan over the counter. Narcan is the reversal agent for opioids. You can only get the nasal spray over the counter, but the state public health officer signed an authorization that we can dispense it over the counter. So if you know anybody that would benefit from that, get it in their hands. Have it available, because it was a really good win to get that over the counter, so we can reverse these potential overdoses. And like I said, get them out of your home. If you're not using them, get them out. We got a safe, easy, secure way for you to do that now. Continuing on with medication safety dues, participate. One of my favorite things when I practiced in community pharmacy was interacting with customers and answering their questions. We would often do what was called medication and therapy management sessions, where the pharmacist and the patient had some dedicated time, either in the store or on the phone, that we sat down and went over their entire medications and all their disease states. Most times than not, I was able to provide a recommendation to them. Whether they weren't taking something the right way, they didn't use their inhaler the right way, they used their rescue inhaler more often than they should have, they weren't injecting their insulin correctly, or they just didn't even need it. And most of the time, I was able to provide a recommendation that would have been beneficial to that patient. We want you to ask questions. A pharmacist is the most accessible healthcare provider. You can walk into any drugstore, and within a matter of minutes, sometimes seconds, you can have somebody with a very advanced degree to be able to talk one-on-one with you. So utilize that. We're here to serve the public, and we are happy to talk with you and answer your questions at any time. Like I said, we're the drug experts. We're valuable resources for drug information. And an informed patient will always have a better outcome. Okay, switching gears and some of the things that you should not do with medications. Don't ever share. I know sometimes that might be tempting. You wake up with your legs swollen, and you know your sister takes Lasix, but you know what? The doctor hadn't prescribed you Lasix, and it might interact with some of the medications that you take. So never ever share medication. And you don't want to take expired medications either. I mean, most of the time when you get the little pill bottle from the drugstore, it's good for a year in that pill bottle. So after that, just go ahead and toss it, bring it to the bin. We can get it out of your home for you. The DEA does drug take-back programs, and I think the closest one is probably Birmingham, if I'm not mistaken. But you can bring that to us anytime. As long as the pharmacy is open, you can drop it off. Don't alter your medications, such as split them in two, halving them, because it can affect the way they work, especially medications that are extended release. Some are okay, but most are not, because those medications are designed to slowly let out medication over a period of time, but when you start altering it, that may all happen at one time, and you may get all of it at one time. So always ask before you do that. Don't change the dose or frequency, because that can increase or decrease the amount that you're going to give. And don't stop anything. If you have a question or you think you should stop it, ask. If you have children or grandchildren, don't use a teaspoon to give them anything, because a teaspoon varies by 2 or 3 milliliters based on the company who made the teaspoon. Use a dosing syringe or a dosing cup. Medication adherence. This is a big thing. Half of the patients with chronic illnesses don't take their medications as prescribed, and 55% of the elderly are non-compliant. Well, there's really consequences when you do that. You're taking medication for a reason, because if you don't, you're not relieving that symptom, you're not improving your quality of life, you're not decreasing your longevity, and it could be life-threatening. Some of those medications that we take every day are very much needed to keep our heart going, keep our cancer level down so we can, treat the cancer. And it increases, when you don't take your medications, it increases the cost of health care. Look at that staggering number of $500 billion of avoidable healthcare costs annually in the United States. That's 16% of the budget. So taking your medications after you're prescribed is a really, really, really big deal. I like this little chart here. It kind of shows you 5 arms of the reason people don't take their medication. If I can get the clicker going, pointer. Maybe I can. There's different reasons of why people don't take their medication. Social and economic reasons. Some of them cost just too much. The healthcare system. However many of you have gone to the drugstore and say, well, the insurance needs a prior authorization for that. Condition related. A lot of times we don't feel our symptoms, even though there's a reason for us to take it. It could be therapy related, because we're going to be taking this pill for life. And, that's a lot for us to process. Patient related. You may have somebody who has visual or hearing impairment. And there's a lot of different things on this slide, but here's the 5 arms of the reason people are non-compliant. Now, the ones that I most likely see in practice were these. It would always come down to income. A lot of time our seniors are on fixed income after retirement. They have transportation problems, but there's ways that we can work around that. You can use generics whenever they're available. They're always going to be cheaper. Financial assistance programs. To give you an example, my mother took a medication through a financial assistance program because the copay was $500 a month. And I never thought that she would qualify for a financial assistance program. But you just report their monthly income, and because the doctor's office said, no, it's you don't have to be waiting on the poverty level to apply for these. If you just draw Social Security in retirement, you probably will be approved through some of these programs. Samples, you can get samples from the doctor's office. We can't handle samples, but the doctor can. So you can always ask your doctor's office, and sometimes there's some discount programs that you can, and our specialty pharmacy works daily with financial assistance programs. So we're good at helping out those patients that use the specialty pharmacy on finding those financial assistance programs. Forgetfulness. Well, I just forgot to take it. We talked about pill boxes. If you don't use one, get you one. I think we probably have some at the hospital we can give you. You've got something in your chair today. And if you're going to be on the road or traveling, make sure that you have a way to do that. So I know, if you're going on a church trip and you're going to go majority of the day, but you take something that had to take 3 times a day, looks like that little pill box that you got in your chair, you can throw it in that and you can take it while you're away from your home. And when you forget, you either overtake or undertake, because I'm guilty of that too. Medication-related factors, the timing of doses. We talked about trying to get on a schedule, whether you take medicine 1, 2, 3, 4 times a day, or however frequency of which ones you take. Side effects. If you have any kind of side effects, let us know. We can try to work around that. We can consult with a doctor on your behalf if we have to. We don't mind at all. And talk to your pharmacist about how to simplify regimens. I did that all the time in medication therapy management sessions. We would try to simplify things. Even if we suggested a drug that we could take from a different class that accomplished the same thing, you forget to take it twice a day, but we can get to once a day, that's a win. So we can help you with that. Other reasons people aren't compliant: vision, hearing, swallowing problems. But if you have a swallowing problem, we can offer medication most of the time to get it in a liquid form most of the time. So at the hospital, we're poised to be able to meet you at your point of need, and that includes your pharmaceutical needs as well. Like we discussed earlier, we have 3 licensed pharmacies at the hospital, including myself. There's 9 full-time pharmacists. We have a clinical pharmacist that's going to help take care of you while you're in the hospital. We have an oncology pharmacist that helps dose and mix chemo for our oncology department. And we have a community pharmacist in our apothecary and specialty pharmacist in our specialty pharmacy. And we obviously couldn't do our work without our great pharmacy technicians, and we have 8 full-time technicians as well. So we want to be your pharmacy home. So if you have any pharmaceutical needs, we're able to take care of those for you. That concludes